Let's get into it. Yeah, it started from nothing. Now I charge per breath. I was overlooked. Now I'm booked past death. Had tables turned. I flipped the room. Now they whisper my name like I'm bad juju. I birthed trends they try to mimic. Did it solo, ain't no gimmick. They took notes while throwing shade. Now they pressed and I got paid. I'm not one of them. I'm one of one. Trying to match my glow. Baby, you're outdone. I'm made for bigger. Now basic. Made for thrones, not fake shit. I don't chase, I check. I don't follow, I flex. I'm made for bigger things. Tell the room I said what I said. Big body blessings, big boss moves. Try me and end up a lesson. They talk about me in rooms I don't enter. I haunt them like regret, make them bitter in the center. I'm that girl, the headline in the smoke. They playing in mirrors, I'm shattering your.
All right, everyone. How are you? And welcome back to the Ask Astria show on WMPR 90.1 out of Jackson, Mississippi. All right, today, guys, this is Mental Health for Minorities Month. So Minority Mental Health Month. Last month was June, and so we had Men's Health Month. Now we're sliding into Minority Mental Health Month, and we have a guest, a returning guest, Dr. Torrance Green. Did I say that correct? Is it Torrance? It's not.
That's
Terrence.
right. That's
Okay.
right.
How are you, Dr. Green?
Well, thank you. And thank you for having me.
Good. And so have you been busy? Hopefully not too busy since the last time.
always, but busy doing good things, so it's all
Good.
good.
Busy doing good things. That's good. So, Dr. Green, it is Minority Mental Health Month, and your specialty is around kidney health. Did I say that correctly? Or
Yes, that's right. That's right.
Yes, that's correct. So I want to talk about, let's talk about minority mental health from where we come from. Let's talk about that for a second. When we talk about minority mental health, maybe some of the things that we might, being from the rural areas in Mississippi, some mental health challenges that we might see on a normal basis that people might not think are mental health issues. Are there some things you can identify with?
Well, sure. I think that everyone who is getting used to the way life can life has challenges, and so the question is, how does that weigh on our ability to kind of function and to be able to maintain our relationships, and in our kidney population, of those folks who have chronic kidney disease. Certainly, depression is actually one of the top comorbidities that we have to monitor, and that's whether you might have had some deficits or challenges coming into the diagnosis, or just kind of getting used to them. And so, depression, of course, is the one that we spend a lot of time talking about. But there are certainly others that we have to keep our eyes peeled to.
So you said a word, and so I would like to make sure that my listeners they really understand and are able to digest what we're saying, because I know I talk to a lot of professionals such as yourself in the health field, and sometimes the words can be really big. So
Sure.
when you say comorbidity, can you break that down and tell us what that means?
Well, that's essentially something you're also sick with. So there may be one thing that may be driving one's health, but of course there are other things that may be contributing. And so a morbidity, something that we describe that it hinders you, and so a comorbidity is another diagnosis that hinders your health.
Now, with that being a diagnosis, and this is a little off, I'm gonna get back on topic, but with that being a diagnosis, is that something that insurance can pay for?
Oh, certainly. I think the challenges often are some of the treatment options are not always reimbursable by the insurance companies, but there are lots of resources that are available to overcome that as well.
Okay, I like that. Now, you talked about, when life is lifing, and I know, being from a rural Mississippi, we do have some adults that are still, our elders that are still, alive, and they're still in the back roads, we can say, of Mississippi. And lifing, when you say lifing, I think of it as simple as the way everything is transitioning to technology. Have you seen seniors come in or people come in that are having to get used to technology, or technology affecting, um, not so much as just their health in general, but we're going to say causing maybe depression or anxiety?
Oh, yes, ma'am. I mean, I think that the way that we ask our patients to engage with us is a challenge. And so we take for granted that everyone operates with a smartphone or, iPhones or Androids, even. The fact that lots of places in Mississippi don't have good signals to be able to access the internet, and just the ways that they access information. Lots of my patients, they do a lot of Google searches, and some of my senior patients, they don't have those resources or not able to navigate them as easily.
Have you ever seen patients with a smartphone but still not really as savvy as they probably can be?
Uh, yeah, sometimes I had a gentleman. He said his phone is smarter than he is. That's why they call it a smartphone. So,
I love it.
right.
And definitely technology today, and using technology is pretty hard, because a lot of times you have to go to technology in some of these healthcare organizations to look at your test results. You have to log on to my chart, or you have to log on to, I think Helo is another platform where we have information that comes from the doctor and we communicate. And so I know that that can cause a lot of challenges when you can't get to your information. And to be able to use telehealth, I think personally that caused a lot of challenges. I don't know if telehealth is something that you guys are able to use when you're talking about kidney health, or do you need patients to be able to come in?
Certainly, I try to use telehealth as much as I can. I also am aware of lots of folks who don't have the conveniences to be able to travel to the clinic. Sometimes they don't have transportation or that kind of thing. So we use it as
Oh, you went out on me.
but did I freeze up?
You did freeze up. It's
Okay, all right,
okay.
all right. Yeah, so we use it as an extra way of being able to take care of our patients. But I just happen to be a little hands-on, so when I can see my patients, I like to see them directly so that we can kind of get to some of those things that may be intimidating when you're distant.
So, Dr. Green, when we talk about minority mental health,
Mhm.
that's a thick one. I'm gonna call it thick. It's a thick topic right there. But
Right.
when we talk about minority mental health, and we talk about the patients that you're seeing, do you see a lot of? Would you say, or have you done any type of assessments to see the amount of patients that come in with kidney issues that do have mental health challenges or need mental health services versus the amount of patients that you have that might not?
Oh, sure, sure. I'm active about screening for depression, partially because we know that the prevalence of these diagnoses are higher in minority populations, but also they impair our ability to do the things that we plan to do in terms of taking your medications or applying the resources that we expect. And I think that one thing that gets missed in the discussion about mental health is, what's good for one person and the standard for that person may be different when it comes to another. The neutralizing factor, I think, is how does it affect your function and how does it affect the relationships that you maintain.
When you say different, I mean that's a little new for me. So when
Mhm.
you say mental health, so are you saying that when I'm diagnosed as depression, the treatment options for someone else might be different?
Well, that and the fact that there are some things, for instance, sleep. I think sleep is one of the things that we use to gauge whether or not someone is clinically depressed, not just in a depressed mood, but actually meets the criteria for depression. Well, some folks will go through, several days where they are up all the time, and then they just kind of target their lives to be able to sleep on the weekends. Well, they're still able to function, maintain the relationships, and so, but that's a little different for somebody else who has interruptions in sleep. And so, and sleep is actually one of those things that's common to several diagnoses in the mental health arena, including bipolar disorder and depression. So it's case by case sometimes.
Mhm.
But so when one person is kind of gauging themselves against other people, they think, well, because we all do it, maybe that's normal. But we have to dig a little deeper to see how is it affecting your function. How is it hindering your ability to be able to adjust to things that are happening in your life? So yeah, that's I think where having providers sit down and have conversations can be help to people who are kind of trying to figure out how they can improve their mental health.
And so we're thinking about kidney issues, kidney failure. I mean, I can see that causing, I'm going to start with causing anxiety along with depression as well. Um, and then what if, I mean, even if I ADHD, I mean, I can see, me finding out that I have kidney issues, that being something that keeps me busy, trying to keep my mind off of it, and that elevating as well. Um,
Right.
I can see, some of these diagnoses, being the cause of some mental health challenges. But would you say that there are some mental health challenges that can actually be I'm going to say, a catapult for some health conditions, that a lot of health conditions that we're seeing in the minority space?
Yes, ma'am. I definitely think so. I think that, for instance, there are some folks who are challenged with kind of authority or trusting people who may have a certain degree of authority.
Hmm.
And so there's a very wide difference between saying that I'm going to be invested in my own health and be an active participant in my health rather than just dismissing what some that person outright. So there's a such thing as we call an oppositional defiant disorder, and so that comes to bear sometimes, and we have to tease through that. Then on the other hand, there are folks who are always on the other end. They may appear to be too trusting to the degree that somehow there are other things that underlie their ability to engage with healthcare providers to the degree that they want a certain amount of reward. They're willing to introduce false symptoms to gain diagnosis. We call that a Munchausen's disorder, where and there's another one, as a matter of fact, Munchausen's by proxy, so that you're taking care of someone who happens to have a disease where they gain attention by introducing false facts into it. Well, that actually can serve as a way to distract us from being able to take care of things that we really ought to. Now, some people may call that um, kind of being um, someone who goes to the doctor all the time. The diagnosis is
Hypochondriac?
a
Is that
hypochondriac. That's exactly right.
look at
Thank you,
me with
thank
the
you, thank you.
term?
There you go. There you go. Some people might but it's a little bit different.
Mhm.
But nevertheless, there are things that we just have to kind of monitor for because we don't want the distraction to prevent us from being able to take care of something that may really be going on.
So are you saying that oppositional defiant disorder and Munchausen disorder, are you saying that these are mental health challenges?
Oh, certainly they are. Certainly they are. We don't always understand the root cause of them, and I think that a lot of people, when we think about mental health diagnosis, they see that there's somebody who's going to kind of identify things that could be improved, opportunities for better mental health, and you're going to stretch out on the couch, and we're going to go all the way back to when you were wearing diapers and try to we're not always able to do that, but certainly the way that we can can ascertain that there are problems with the way that the patient is functioning and that it relates to the way that they may be thinking about their world, we just kind of engage it where it is. And then if we're not able to enlist that patient in their care and participating with that, that becomes a real problem. And there are a whole list of diagnoses that come with that.
Would you think that I would think now this is just my little brain out here in the trenches, but I would think that a mental health provider would be at all clinics because anytime that you have to go to the doctor because I'm sick, because something's wrong, or just to get a checkup, I mean, I would think that a mental health provider would be someone to kind of stop and talk to, or just it really would be useful in a clinic. Is that something that you see healthcare going towards, is kind of a mental health provider being some, like, that you can find a mental health provider in any clinic that you go to? I guess that's what I'm saying.
Well, I think that would be excellent. I think that as the benefits become more available for pharmacologic therapies, for screenings, then we will see more of those resources available to people to kind of screen for those things and to be of help. I will say, however, that in the past, counseling and those kind of things have been prohibitively expensive for most folks. Therapists can be anywhere from $100 an hour and up. So to the degree that lots of folks, number one, don't spend enough time with their healthcare provider because you got to get so many appointments within an hour or within a day. So that's a barrier. And then the other thing is that even if you do identify those folks who could benefit from them, they just don't have the resources to have the treatments. One big change that has happened in the state, when I was growing up, we had a mental health inpatient option, such as the state hospital at Woodfield, that had a long-term kind of benefit for patients. If right now, some 20, 30 years later, there just are so few places where folks can get treatment on a protracted basis. The way that just that challenge alone, it's kind of like they'll bring you to the hospital, kind of take care of acute psychosis or acute challenges, and then you're kind of discharged with the idea that you're going to be able to benefit from a series of community resources. Well, though, whether it's addiction or those resources are often very limited. They're based on grants that may be intermittent, and those systems that are releasing folks to the community are not always aware of the changes that are going on in the community. So it's a very big challenge, I think, to take care of, like, mental health, because it's such a long-term diagnosis to be able to manage.
And even with mental health challenges, I mean, let me ask you this as the healthcare professional before I say this. Would you say that let's say that I have, I'm noticing that I'm up sometimes and I'm down sometimes. I'm noticing that I can't really control my mood. I'm noticing that I have some anxiety for no reason. I'm noticing some heart palpitations. If I don't take care of those things, as far as mental health, can those snowball into larger mental health challenges?
Absolutely, absolutely. There's a growing recognition of behavior as a part of obesity that had not been recognized before.
Mhm.
And to the degree that, for instance, as you mentioned, that people have these alterations in mood, and that to relieve those things, there can be dependence on food. Well, I think that everybody in the arena, at least who is interested in weight loss now, talk about these GLP-1s. And one thing that it really helps with is being able to suppress the behavior of frequent eating, and that may be part of this is reason for success. So certainly, those kind of fluctuations are they can become dangerous to the point where you gain weight, where you maintain elevated blood pressures because of your your stress levels. Stress is manifest in the body often with hormones, and they have lots of different effects. There are many of my friends who in the gynecology arena who become aware of these kind of things in terms of fertility. So yes, mental health has a very big impact on the pathogenesis or the development of diseases that it behooves all of us to be able to kind of screen for.
So with that being said, if we know scientifically that small mental health challenges, acute mental health challenges, such as anxiety, depression, those type of things that might happen normally within some of our environments, and so we don't really notice it or we don't pull it out or recognize it as a mental health challenge. If it's scientifically, we can say that those things can snowball or build into larger mental health challenges, then I mean, what's really keeping us from making mental health care more accessible to the communities? It's specifically those communities that have lack of resources.
I'd say for sure that one major obstacle is just the resources to make them available. Um, and like I say, lots of I'm blessed to be able to have a practice and a size of a practice that allows me to spend a little bit more time with my patients. So, but lots of other practices they don't do that. So just having the resources to be able to spend the time to administer the treatments, to do the follow up, and to maintain insurance and those benefits on a protracted base. I mean, just when you just mentioned that, I thought about a particular patient who I had referred for counseling, and they were doing very well. He was the kind of the breadwinner in his household, and he was maintaining lots of stresses. While he was in counseling, blood pressure was doing well. We were taking medicines off. Gentleman lost his job, and all of a sudden he didn't have the resources to do the counseling. Now we're back on some of those blood pressure medicines, and so I think the big part of it is just the resources.
So would that mean, what you saying, that it's the resources? Is it that mental health care costs a lot, or is it that mental health care takes a while, and so we don't have doctors don't have time to perform mental health care? What about, I mean, what is the real challenge? I mean, I understand that lack of resources, because lack of resources keeps hospitals out of rural areas. Lack of resources, people can't eat the foods that they need to eat. Lack of resources, people, their doctors are just not there. So I mean, when you say lack of resources that's keeping us from proper or adequate mental health care, just the small things, are we talking about the cost of a mental health therapist?
Yes, we're talking about number one, just having the insurance to often to access health care, to then also then be referred to some of these mental health providers who are more efficient, but they're more experienced with being able to to treat these conditions, and the amount of time that it takes to be consistent with those things. So even if in that gentleman's case, if his wife was able to obtain a job that would kind of kick in and do some of those things that he couldn't do in terms of providing insurance, well, she had her own limitations, and I think that that's a big difference in the minority population versus that of the dominant culture, is that we not only are sometimes at the margin of resource availability, but so many of our family members and our loved ones are also at that point. So it's a lot easier to accumulate those deficits and those problems in our community than it is in communities who have more of those resources.
So I heard you say insurance access. Um, Does insurance pay for mental health? And if so, what has to be the diagnosis in order for insurance to be able to pay for mental health care?
Yeah. Well, there's some limitation. What I will say is one big improvement, I think, probably in the last 5 years. Maybe 7 years or so, but here recently, let me just say it that way, has been that Medicaid in Mississippi, which is a state funded kind of partnership with the federal government, but they provide a lot of resources towards mental health in terms of family counseling, individual counseling, medication reimbursements. They do a much better job than they used to. So that that's positive. On the other hand, though, I'll say that the standards to obtain Medicaid, in particular for African American males, is very high. And what I mean, the amount of money that disqualifies you, or the amount of income that disqualifies you from Medicaid, is very low for most men in particular. Women do have the benefit of usually being the primary provider of children, or that kind of thing. So that opens some doors for women, but for men, it's very difficult.
I didn't think about that. I didn't think about men being on Medicaid. That
Yes,
never
ma'am.
really
Yeah,
crossed my mind. I didn't think about that. You hear Medicaid, you think about women and children.
yes, that's right. That's right. Yeah, it's
Interesting.
kind of designed that way. Of course, there are kind of paternal biases within our public policy sphere that wants to discourage men from being able to have that as an available support. The idea is that if you're an able-bodied man, you should work. Well, the question is, what happens when you're not able-bodied and you're kind of you're not quite sick enough to have that benefit, but you're too sick to kind of gain your maximum potential. And I will say sometimes those illnesses, I'm not talking about just in terms of diagnosis where kidney disease and cancer and those kind of things, but mental health, addictions. I think is another mental health, in addition to anxiety and depression, is somewhere that we really don't have enough support for in our communities. The resources are limited, and even if one can get those resources, sometimes there are challenges to being able to live while they are maintaining those resources. And so
So,
yeah, you can go on and on about the limitation of resources, but the question I know that most everybody wants to ask is, well, what do you do? What do you do otherwise?
mhm.
And so, number one, I think that just that self inventory, just to say, okay, well, look, what things are going on in my life and what are my challenges. Number two, to realize that the medical professionals that are available to you are have ears for those things but you have to kind of bring those things forth. And I'm talking kind of pointed my conversation particularly to African American men, because they're not always forthcoming of those challenges. And number three is to string those resources together, which includes the church, by the way. Many of the pastors or the of our churches also have degrees in counseling, and so they can kind of fill in those places where the typical Whitfields or counselors may not be able to, or the person may not be able to afford them.
I like that you said that. And I want to get to churches. I want to talk about addiction briefly
Hmm.
as far as a mental health challenge. At what point when you say addiction, we're talking about drugs, alcohol. Um, so I guess my part about addiction being classified as mental health challenge in general, just in a general sense, it seems to me that there are chemicals in these different products that causes you to become addicted. And so to me, that kind of to me it feels a little unfair to say that it's a, if I'm a smoker, I'm smoking cigarettes, that I have a mental health challenge because I can't stop. I'm having hard time stop smoking cigarettes. or even with drinking alcohol, your body becomes used to it because of the chemical reactions that go on in your body. It becomes challenging to stop, or the side effects afterwards, people continue to do, to intake or digest those harmful products. So is when you say addiction, is it really a mental health challenge when you're addicted to something, or is it the actual product that has these addictive chemicals and products in it that causes you to become addicted to it?
I think it's both. I think it's
Okay.
both. As a medical provider, certainly we have to remain aware of the physical challenges to addiction, and especially those who want to stop. So, and that can go anywhere as far as being kind of benign or harmless if you stop it, other than some mild irritation. You don't like the dog that day, or as severe as those folks who are using things like opiates, heroin, Percocets, and Norcos and hydrocodones, to the degree, and alcohol, by the way, such that when you stop introducing that chemical to the body misses it
Mm-hmm.
and reacts as a result of it. So yes, there is certainly a chemical dependency, but there is also a behavioral dependency that underlies that often. That even if we do the detox, or the detoxification of the body from those agents, that the behaviors underlying that, those reward systems, they still perpetuate, or they maintain those addictions. So yes, it is definitely a very strong mental health piece underlying. Let me just point to one in particular that's not chemical:
Mm-hmm.
gambling addiction. Gambling addiction has a very high mental health. I keep saying comorbidity, but as is also diagnosed, and things that are underlying in terms of how is it that you can do something that appears to be detrimental to one's, like, personal life and even sometimes health, but nevertheless continue to do it. We'd have to categorize that as as an error in the way that that person is processing their behavior, to the degree that yes, that would be a mental health challenge and be an addiction.
So when we're talking about minority mental health, are there some particular mental health challenges that you are familiar with?
Oh, yes, ma'am. Yes, ma'am. I mean, we have to do we part of our training is to spend a good bit of time in psychiatry,
Mm-hmm.
and like I say, in taking care of a high population of minority patients, and in renal patients. Yes, we see a lot of mental health, and I mean it's varied. It's
But
varied.
specifically to the minority population,
Yes, ma'am. Yes, ma'am. Absolutely.
what
Uh,
would some of those challenges look like that would be particular to the minority population? Or
well,
are there any?
yes, yes. I would say this. Okay, so they come in so many varieties, but I will say that we generally think of these in a couple of categories. We think of the one is a category of psychoses, and those are mental health challenges where our patients are thinking about things uh, in an erroneous way, where they are having what we call delusions, hallucinations, and suicidality, and homicidality, that's related to the way that they're thinking about the world, to the point where things that would someone else might not be intimidated by. These folks are challenged by putting an exaggerated emphasis on those things, and it impacts their lives in a bunch of different ways. And while we're talking about suicidality, there is a big misconception that people who have suicidal tendencies, or who end up suffering from suicide, will show some terrible signs, like, they'll threaten and say, I want to kill myself, or I don't feel good. No, we have to be very careful about checking up on those folks, on each other, because by the time that that person loses the ability to cover up for the things that they're feeling inside, and they reach those breaking points, often it's too late.
Mm,
So, but nevertheless, but the psychoses are a group of those diagnoses where people are not thinking about reality in a proportional, or in a measured kind of way. And so those diagnoses under that category would be schizophrenia, or so-called diagnoses that also includes schizophrenia. So you can have schizophrenia and depression. That would be schizoaffective. And so that's one group of diagnoses. Now, there's another group of diagnoses that we call the neuroses, as compared to the psychoses. The neuroses include things that we're more aware of, like depression and anxiety, and that they're different levels. Now, there are also a big group of diagnoses that we call personality disorders,
mhm,
and they cluster into three main groups, and there's a lot of those. But there's a new word that I hear a lot: narcissist. And we use that word to kind of describe people, for a variety of different things.
mhm,
Sometimes they're right, and sometimes they're wrong. But I'm just saying, and those compared to the psychoses and the neuroses, which have a lot of pharmacologic effective means, the personality disorders, really, the best way to treat those are with the thing that we call cognitive behavioral therapy, which
mhm,
basically means that you have to do a lot of counseling for a long time, and then try those techniques out that you learn in counseling, see if they
mhm,
work, which ones need to be tinkered. But I mean, that can be a very long process. So when we talk about the challenges in our community, in African American community, to take your medicines, which often have many side effects in terms of the psychoses, or
mhm,
to be able to afford the effective medicines in the neuroses, when we're talking about ADHD or depression or anxiety, or the time. Those things, the money and the time, are things that in our African American community that we just don't have a lot of.
And is that because of, do you think that's because of things such as lack of opportunities? Or, I mean, what makes that a minority, those things more prevalent in the minority community?
Yeah, I think it's partially is kind of socioeconomic.
Okay.
If you are
Oh, you froze on me.
that you may be working at nighttime, then that's going to impact one's sleep, and obviously that'll impact the way that you engage healthcare. Or if you, like we said earlier, if you don't have the benefits. So some of those are socioeconomic, but some of them are cultural.
Mm,
There are certain behaviors in our community that we kind of reward, that can be detrimental. For instance, the kind of strong, silent type of man.
mm,
That may be an ideal kind of persona, but it also comes with the risk of people kind of harboring mental health disorders. And so both the cultural part of our minority communities, and the socioeconomics, and then the third piece, I think, is just the distrust that exists in populations that have been oppressed, and their kind of reluctance to engage the resources. So I think all three of those things contribute very strongly to high prevalence of mental health disorders in our community.
So we've talked about a lot, right? And
Mhm.
so I would like to know, is there anything that we can do to help change some of these policies out here that can allow us as minorities to have more access to mental health, services? And when I say what can we do, I mean, I'm talking about insurance. I mean, where do you really go to say, hey, we want this included in our insurance? How can someone just one of our listeners that are out there the next time, is it in voting? Because you don't think about that when we think about voting. No one really talks about insurance and what insurance accepts. It is whether or not we can we're eligible for insurance, right? Do
Hmm.
you
Hmm.
are you eligible for affordable, health care, or Obamacare, as we
Hmm.
say. Um, but no one ever talks about how do we work as a community to change what insurance accepts or does not accept and say, hey, we don't really need that, but we do need this.
Yes, ma'am. Well, in terms of insurance is its own monster, and so I think that in our communities, those small business owners and those people who are kind of engaging the insurance companies to select plans, were they in a position to be able to advocate or to select plans that include that coverage, that would certainly encourage the insurance companies to make that benefit more available. But I think that there is an evolving, and this has been coming up for a long time. I think that we probably first started to realize this with the veterans that were coming back from Vietnam. The
Mhm.
impact of war and these kind of conflicts on the mental health of populations. So I think there's an ongoing, evolving conversation about what benefits need to be extended to lots of people. In other words, Medicaid expansion. And so I think that that's another place that our community can coalesce around, demanding of our politicians to encourage the expansion of Medicaid. And what do I mean by expansion of Medicaid? Meaning covering more people. What do I mean by covering more people? Lowering the requirements to get that benefit,
Mhm.
so that it expands. Lots of other states do it automatically. I think there's just a conservative culture here that wants to either, if you could say, on one side, maintain a posture that seems conservative, and then on the other side, that chooses not to be engaged into the issues that affect our minority communities. Either way, we've got to demand of our folks who are at that table to, yes, expand Medicaid, and in so doing, make those resources more available for mental health care. But I think the other thing is just being able to do some of the things that we know help us to maintain mental health that are free. More sunlight, exercise, and maintaining good relationships. Those are three different things that and by the way, I just want to put in you know uh, that the church is a very good resource for being able to manage these kind of things. But I think exercise and sunlight and church engagement and maintaining good relationships all go a long way for helping us maintain good mental health.
I'm glad you mentioned churches again and brought us back to that, because I did want to touch on that, because I do think that that is a very big key and I think that is a great way that we can start moving forward with making mental health more accessible. I know that my very first therapy session was with a Presbyterian pastor back home. And it was because someone said, hey, you should go talk to Pastor such and such, because I wasn't really sure. It's not that I didn't believe in mental health, but I was I was on that line of teetering of thinking. My thought process around mental health was something's wrong with you if you go and seek mental health, not so much
Mhm.
as just to talk about the challenges that you're having and the feelings of being overwhelmed. And so I went to him because I felt like, oh, well, I'm not really, I don't qualify for mental health therapy, but I do feel that I do want to talk to someone who can help me with these feelings that I'm feeling, which are, to me, are not normal. So when we say that, so what are some suggestions that you can think of when we say that churches should be more involved with providing access to mental health? Are we talking about group sessions on weekends and marketing that to the congregations and the community? or are we talking about really ministers being listed as qualified mental health therapists?
I think that the church often probably miss lots of opportunities to provide this resource to their to the folks that are members and who are parishioners. Number one, I can say that there are lots of mental health providers that worship, and that pastors or churches might not even know they're in the congregation. And so sometimes it just takes the kind of coordination and organization to be able to make that a ministry as a part of of one's church. But I also think that the other part is creating a space where we, like you said, that we don't put stigmas on on mental health. The
Mhm.
same way that often we say in our churches that we don't like the sin, right? But we love the sinner. And so creating that environment where we say, okay, we know that you're in a season. Some people call it spirits, right? I mean, there's lots of ways that we can talk about mental health that does not put the stigma on that churches could encourage more engagement with their parishioners and their mental health. But I think that the third thing is just being able to um, uh, to support
Mm.
to support and create an environment where we're not saying that you're going to not be wrong, but you want to be more right? So,
Say
you
that again.
know, yeah, so we're not in at least my practice. I'm not in the practice of just saying that I don't want you to be wrong,
Hmm.
because I just want you to be more right.
Okay.
So by being able to define, certainly, in our Christian traditions, heaven is my goal, right? And so, then you come down from there and you say, I want good relationship with my God, and so then all the other things start to, they start to align because you point out where it is that you're trying to go. Well, I think in mental health, that's often the challenge, is that we focus so much on what's wrong
Mm.
that we fail to paint the picture of what could be right.
Mm.
And so when folks think about mental health challenges, that I'm depressed, and this is the way I'm always going to be, and you say, okay, you know what? I want to move from that conversation to talk more about and to feel more of your day and more of your thoughts with what you can do, what
Mm.
where you could be. Could your marriages be stronger? Could your friendships be greater? Could you, be more of a resource for the people that love you? When you start painting those pictures the way
Yeah.
that I know some of our ministers can do, I
Mm.
think it creates the appetite to engage opportunities to improve our mental health.
So there's a space for maybe some trainings for pastors to be more engaged in mental health. And when we talk about more engaged, we're just talking about the way that they do counsel their members. So
Absolutely.
so then, and that, but that still gives me a stigma, to be honest, Dr. Green. I'm gonna speak from the people side. It
Hmm.
still gives me a little bit of a stigma. I mean, I still feel like even at church, it to me it's not going to be a stigma until I see normal people doing it. It's always going to be a stigma to me if I feel like only people who have something mentally wrong with them are participating in this, not so much as a checkup, or not so much as what I'm doing to actually maintain my mental health. Because think about it, people work out not because they want to lose weight, but because they want to stay healthy, right? They want to
Hmm.
keep their blood, make sure that their blood pressure stays down. To me, it's not, it's still giving I have a problem with my mind is a problem for me. And so I'm still not going to want to be seen going and talking to the pastor. Now I'm going to have, I feel, and I want you to kind of speak to this, but I feel like even if we do go to the churches, and now churches are playing a very big part in the mental health space, now you're going to see a decrease in just general going to get some counseling, which I guess, as I'm saying this, kind of is kind of like a therapy session when you go to your pastor to get some counseling, because you're going because you're having some troubles in life, right? Whether it's spiritually and that's the category you want to put it in, or whether you just need someone to talk to about a hard time that you're going through. But to me, it still gives the stigma. I feel like the stigma, is still around. Hey, what's the problem? Until I hear about someone that I feel is normal, or I see and interact with, and I feel like there's nothing wrong with them, and they're going and they're saying that I'm just going just to do a mental health checkup.
Well, and I hear you, and I think that's we're on the same side of that, and I think that being able to see that differently. You
Mm-hmm.
use the word normal, and as long as the attention is outward, well,
Mm-hmm.
I can certainly understand that. But when we talk about mental health, this is one of the few opportunities where you get to be selfish. You get to think about you, and how are you doing. And I think that when we put that reward on it, then the limitations of what other people think will get less important. In other words, I like hanging out with my partners, and they may talk about me when I go to work, but hey, on Friday
Get back.
I like being able to have some money in my pocket, regardless of the stigma, of being, tied to the man. So my point is that we have to do a better job, I think, in the mental health sphere of creating the rewards that are relevant for our communities. Whether and touching on those things that are important to our communities. For instance, I can get I have since I have started talking about erectile dysfunction
Mm-hmm.
with my African American male patients, I
Mm-hmm.
have gotten a significant better buy-in and follow-up than I did before. Why? Because I had to create the reward, because I knew coming in that nobody wants to deal with the stigma of losing their youthful kind of vigor that they would otherwise attribute to having hypertension and kidney diseases, these kind of things. So yeah, we have to do a better job of painting the picture so that the stigma is like, okay, you know what? Yeah, you may think about that, but I sure feel better. And so, you can talk about me all you want to, but I'm gonna hear that with a bigger smile on my face because of the life I'm living otherwise.
I love it. I love it. One more thing. You talked about, let's see, behavior as part of mental health challenges. When we talk about mental health challenges being more behavioral based in the minority community, specifically the African American community, with everything that's going on right now in America, um, to me, if I feel that mental health is something that all African Americans need, and I am specifically calling out all African Americans. They talk about, and then I'm just going to say 40 acres and a mule. I think free mental health care is something that really should be rewarded. It's specifically with everything that goes on politically when it comes to the African American community, with and not so much as is it happening in your community and your community doesn't need it, but it's just the fact that when you see these things happening to a community of people who come from where you come from or who look like it formalizes a fear. I have fear for my nephews, even though I don't hear about a lot of police brutality in the community against African Americans in the community where I live. I still, have a concern for my African American nephews, thinking about when he does get to the age and he's out in college, when he does get to the age and he's out with friends. What are your thoughts around African Americans, just receiving free mental health care?
Well, I think that that certainly would improve things a lot if we didn't have those barriers to screening for people who could get our help. And but I think that one thing that we are challenged with in our community is just being able to call out the behaviors that may be suggestive of underlying mental health challenges, and the fact that lots of times we justify. And I'm going to go back to the addiction arena just to just to just make the point. Um, there is an addiction to pornography that I think is growing, and it creates very um, almost irreversible damages to the relationships that happen between African American men and African American women. Well, you know, it makes money for some folks, and so then we turn our eye to it, or some of us will say, well, he's just being a boy, and that kind of thing. So that arena, I think, is at an intersection between both our cultural kind of cumulative mental health challenge and those of the individual. And so, whether it was free or not, it doesn't cost us anything to close the Pornhub, or to close those tabs. So I do think that certainly making the resources available so that the screenings can happen, so that the discussions can happen, is very important. But I also think that we have to put our emphasis on things that we can do for free. And that's just basically putting some attention on the behaviors that we know that are not doing us well. And that creates the room for us to discover changes. And so that when you bring these things that we can identify, let's always say that the first step is identifying that you have a problem.
Mhm.
That's the biggest part, and that doesn't cost.
So my last question, and it might be a little challenging, but and I know that we're coming to an end of our time, which I hate, but whose responsibility is it, Dr. Green? Whose responsibility is it to change the stigma on mental health? Whose responsibility is it to change some of those behaviors? Are we saying that it's our responsibility to make these changes? Are we saying that it is the policy and government, the policymakers and the government's job to close those tabs, or to say that, hey, you know, um, doing these things are going to cause mental health challenges? Who should be making these changes in these behaviors?
When you asked me that question, I went to a scene in Genesis when God asked Cain, "Where's your brother?"
Mm-hmm.
And and
Mm.
Cain said, "Well, am I my brother's keeper?" I think that that's essentially the question. Do we believe that we are supposed to be our brothers and our sisters' keepers? If we do, then it is all of our responsibilities to, number one, make sure that our mental health is strong enough that we kind of overcome our challenges. Number one, to be able to be an example for our brothers and sisters, but also to be more available to help them overcome some of the things that they do. Now, if you don't believe that you happen to be your brother's keepers, then I don't know how we are going to be able to overcome the mental health challenges that we have, because basically what that basically says is that we're willing to benefit off of the shortcomings of our brothers and sisters. And what that's going to do is just race us to the bottom. So I'd answer that, do you believe you're your brother's keeper?
At the end of the day, and I totally agree with you. I'm a very big believer in self responsibility. It's all up to us to be responsible for ourselves and to be responsible for the people that are around us and in our community. Well, Dr. Green, as usual, it is a pleasure to speak with you. Loads of knowledge. I have learned a lot today, some things that I didn't think about. I knew, but I just didn't expand it as far. But can you tell our listeners how they can get in touch with you if they need your services, or just want to kind of make an appointment with you and they have some health concerns?
Sure, sure. They can call me at Good Faith Wellness, and our phone number at the receptionist desk is 769-572-7496.
All right. Everyone, thank you so much again for joining us. This month is Minority Mental Health Month. And so we are our brother's keeper. So it is all of our responsibility. So one, check your insurance. I always say check your insurance, because you pay your insurance, and it should be paying you. Also making sure that we reduce this stigma, take away the stigmas of mental health, making sure we're taking care of ourselves, we're taking care of our brothers, we're taking care of our sisters and our families and our communities. And so reach out to me, Ask Astria, on social media. You can always reach out to me on Facebook, Instagram, Astria Goolsby. You can always call WMPR 90.1. We're here to help you. We are the voice of the community. You guys have a wonderful day. Until next time.